Welcome, dear doctors. Today, we're going to talk about a medical condition called hiatal hernia. This occurs when part of the stomach pushes through an opening in the diaphragm and enters the chest cavity. It's a condition that can affect people of all ages, but is more common in older adults and those who are overweight or pregnant. In this video, we'll discuss the pathophysiology, signs and symptoms, diagnosis, and treatment options for hiatal hernias. So, let's dive in and learn more about this condition. Hiatal hernia is a medical condition that occurs when part of the stomach protrudes through the opening in the diaphragm and enters the chest cavity. The diaphragm is a thin muscle that separates the chest from the abdomen and plays a vital role in breathing. Hiatal hernias can occur in people of any age, but they are more common in older adults and individuals who are overweight or pregnant. There are two main types of hiatal hernias, sliding and paraesophageal. In a sliding hiatal hernia, the gastroesophageal junction, where the esophagus meets the stomach, and a portion of the stomach slide up into the chest through the opening in the diaphragm. In a paraesophageal hiatal hernia, a portion of the stomach protrudes through the opening and sits alongside the esophagus. Many people with hiatal hernias have no symptoms and may not even know they have the condition. However, some common signs and symptoms of hiatal hernia include heartburn, regurgitation, difficulty swallowing, chest pain, and belching. Patients with hiatal hernias often present with symptoms related to gastroesophageal reflux disease, GERD, or with upper gastrointestinal symptoms. These symptoms can be intermittent and worsened by lying down or bending over. The symptoms may be relieved by standing up or sitting upright. The best initial test to diagnose a hiatal hernia is a barium swallow, also known as an upper GI series. This test involves swallowing a liquid containing barium, which makes the esophagus and stomach visible on X-rays. The most appropriate test to diagnose a hiatal hernia is endoscopy, which involves inserting a flexible tube with a camera through the mouth and into the esophagus and stomach. This allows the doctor to visualize the area and determine the type and severity of the hernia. The best initial treatment for hiatal hernia is usually lifestyle modifications, such as losing weight, avoiding large meals, and elevating the head of the bed. Medications like proton pump inhibitors or antacids can also help reduce symptoms. In severe cases, or if symptoms do not improve with conservative measures, surgery may be necessary to repair the hernia. Complications of hiatal hernia can include GERD, esophagitis, gastrointestinal bleeding, and strictures. In rare cases, the hernia can become strangulated, which means that the blood supply to the protruding portion of the stomach is cut off. This can lead to a medical emergency and require surgical intervention. In conclusion, hiatal hernias are a common condition that can be challenging to diagnose and manage. As healthcare professionals, it's important that we stay up to date on the latest diagnostic and treatment options for hiatal hernia to provide the best possible care for our patients. We should also continue to educate our patients about the signs and symptoms of hiatal hernia and encourage them to seek medical attention if they are experiencing persistent discomfort or pain. With our collective knowledge and expertise, we can help our patients manage their symptoms and improve their quality of life. Thank you for your attention today, and I hope this presentation has been informative and helpful in your practice.